So let us discuss why raise amputation of index finger is better than amputation through the MCP joint. So this might be applicable in most of the cases, but in select cases the scenario might be different. So what happens in raise amputation is that we amputate the metacarpal through its base, keeping the insertion of the ECRL intact. So this has got several functional and aesthetic advantages. Functionally, removing the second metacarpal allows the middle finger to shift more centrally. Probably it enables it to take over the role of the index finger and thereby preserving the tripod pinch, which involves the thumb, middle and the ring fingers. In contrast, if there is a residual MCP level stump that can interfere with thumb opposition and compromise the grip strength. Now, cosmetically as well, raise amputation results in a smoother contour of the hand, and whereas if we go through the MCP joint, there is a protruding metacarpal head or a visibly shortened finger that is probably more noticeable and aesthetically not as pleasing as a raise amputation. Raise amputation also reduces the risk of complications such as painful neuroma or tender stumps, which can occur more in case of amputations at MCP joint level. In addition, in certain select group of patients which require prosthetic fittings, raise amputation probably facilitates a better fit and a more natural appearance. So overall, raise amputation optimizes both function and appearance, and therefore we specifically tend to preserve it or prefer it in case of index finger amputations.